right, Dr. Bradley, I think we're ready.
All right. Good morning, everyone. Can everyone hear me okay? Shelley, can you hear me?
Yes, thank you.
Okay, thank you. Just confirming.
All right.
All right, we will go ahead and call the meeting to order at 10:30. Just a few housekeeping items since we are in a virtual meeting. Attendees are advised that this is a public meeting and is being recorded. Anything stated or posted in the chat box or on your webcam is part of that recording, which is shared on the Bureau's website. Please mute yourself when you're not speaking. If you're attending by telephone only, press *6 to unmute yourself. Shelley and Julia are monitoring the chat box and will provide any questions or comments that come up in that setting. And for everyone's benefit, please identify your name before speaking so that we can capture who is talking for the records. I will move on to roll call. Thank you, Shelley.
All right. Alberto Gutierrez. Bob Ramsey.
Here, present.
Brian Smith.
Present.
Chris Salvino. Dale Woolridge will be absent. Dan Spade. He checked in the chat.
Dan Spade's here.
Oh, thank you. Deborah Garambe.
Here, present.
Thank you. Franco Castro Marin. Gail Bradley. See you.
Present.
Garth Gamer.
Present.
Glenn Kasperzik.
Present. Good morning.
Good morning. Heather Miller.
Present.
Howard Reed. James Hayden.
Present.
Melanie Mitros.
Present.
Michelle Preston.
Present.
Mike Duran.
Present.
Neil's going to be absent. Rebecca Harrow.
Present.
Where'd she go? I see her. Ryan Page. Rodney Reed.
Present.
Roy Riles.
Present.
Sarah Parati.
Present.
Sharon McDonough. For roll call. I see you waving. Todd Jaramillo.
Present. Good morning.
Good morning. Vince Martinez.
Present.
Vivian Gellert.
Present.
I count 20. We do have quorum. Thank you.
Excellent. Thank you very much, Shelley. Moving on to the chair report. The attendance report is in your packet. Just a friendly reminder, if you do have 2 consecutive missed meetings, the Bureau will reach out to you to inquire if you're still interested in participating on the committee. In regards to the vacancy report, I just wanted to briefly take a moment of silence in recognition of Chief Bob Costello, who unfortunately recently passed away. He was really a huge part of the EMS community in Arizona and a big part of this committee as well for many, many years. So we'll just quickly take a brief moment of silence. Thank you. All right, thank you. We also have another member that I think wanted to share that they would be leaving the committee as well. Melanie, I just wanted to see if you'd like to speak at this time.
Hi, good morning, everyone. Yeah, I will be relocating outside of the state of Arizona at the end of May. So I will need to resign my position on EMS Council due to no longer being an Arizona resident. I will still be continuing to work with Vitalis throughout the summer to support some activities, especially activities we already have going on with the city of Phoenix, as well as the first responder and behavioral health screenings of Ernie and Joe. So I'll still be around in some capacity, but will be resigning from EMS Council. So thank you, Gail.
Thank you, Melanie. I just wanted to give a big shout out to Melanie. She has been a huge proponent of the EMS community throughout Arizona, and really she has spearheaded many of the projects with community paramedicine, treat and refer, behavioral health, and many others. So a big thank you for all your participation over the years and your work with EMS. You will be greatly missed, but I'm glad you're still going to be involved with EMS at the national level. So hopefully we will get to see you soon. So thank you for your participation.
Thank you.
All right. So in regards to vacancies, we do have 2 vacancies for public members. We have a few other vacancies for non-governmental employer of intermediate EMTs, a vacancy for hospital administrator for a county population greater than 500,000, and a vacancy for volunteer medical rescue program representative. To submit an application, go to the governor's website. It's bc.azgovernor.gov. And then there's the option to apply. The roles are appointed by the governor, and the term is for 3 years. Next, I just want to speak briefly regarding naloxone leave behind. This is something that really has become a big program and push for the Bureau and the department. One of the things that we've seen throughout COVID has really been an increase in continued persistence of the opioid epidemic. And we really wanted to help get some messaging of what we can do with the EMS system that's in place in Arizona to address this. For anyone who's not familiar with what naloxone leave behind is, when I first heard the term, it was a little bit of a misnomer. I wasn't sure if it meant EMS were leaving behind their leftover naloxone, but actually what it's referring to, I see them smiling there, is the fact that we're actually giving EMS the opportunity to distribute naloxone to individuals in the community. That individual could be the patient that they're taking care of. It could be a family member or friend, or it could just be someone that comes up to EMS and asks them, do you have the naloxone available to distribute in the community? Typically, you do want to provide some type of educational material with the naloxone, so something to help someone recognize when to actually administer naloxone in the setting of an overdose, and also how to administer this. Naloxone distribution has been implemented in many parts of the country, and they've really shown significant benefits from these programs. In Southern Arizona, Dr. Melody Glenn with Banner University, Tucson, was really the first physician that I saw spearhead this program in Arizona. She started a program for naloxone leave behind in Santa Cruz County and has had really good success with implementing this down there. She thankfully has allowed us to heavily borrow from some of her materials. And the Education Committee has put together a training PowerPoint on naloxone leave behind. The other component that we have, which is displayed right now on your screen, is the Office of Injury Prevention, which is part of ADHS, has the option for EMS agencies to order free naloxone. This is the intranasal dose. So we really want to try to create a package and a program that makes this very easy for an EMS agency to implement. So this is covered by statute. That EMS can participate in this program. We will have the educational PowerPoint available once Education Committee approves that. That will be added to our website. And we will also make sure we share this form of how and where to get free naloxone for your agency. Are there any questions or comments regarding naloxone leave behind?
I have one question. What type of provider level would need to be at the agency to be able to be a part of this program?
For basically EMT up. So EMT, intermediate, AMT, or paramedic. So all levels of EMCTs in Arizona.
Okay, would there be then opportunity for other agencies to provide with EMTs or programs to be able to administer, or not administer, but share this program with agencies, patients, or clients?
Sorry, can you maybe just explain your question a little bit more to make sure I'm understanding it?
Yes, our patients would, run Gellert Health. My name is Vivian Gellert. Hi. And our patients, high rate are homeless and drug users, substance abusers. And we would really benefit if our patients had access to this, but we don't have EMTs. So I'm just wondering, how might we be able to leverage a partnership to offer this to our patients?
That is a very good question. I'm not sure from the Bureau of EMS, we are kind of specific in terms of overseeing and regulating EMCTs. I see Melanie Mitros has her hand up. She may have some input on what an option would be for you. So I will hand it over to Melanie.
I do. So for agencies that do not have EMTs on staff, Sonoran Prevention Works is providing training that you go through online to be able to have naloxone on site. So I will make sure I'll pop it in the chat for who we've worked with, because Vitalist has actually gone through the training as staff as well, so we can have it on site.
Thank you, Melanie. That's awesome. Perfect.
Happy to.
Another reason why we will miss Melanie. All right. Any other questions or comments about naloxone leave behind? All right, so we will keep sharing the messaging. Once we get the training curriculum approved, we likely will send out a Gov delivery communication with kind of a complete packet to EMS stakeholders throughout Arizona to hopefully make it a very easy program to implement with your agency. Next, I'm going to turn my computer a little bit to Chief Garcia so she can give her report. Make sure.
Good morning. How's my audio? Can you hear me? All right. Well, good morning. In honor of EMS Week and Trauma Awareness Month, we want to start out by saying thank you so much to all of our EMS and trauma providers who continue to serve on the front lines. We appreciate you. I'll share a few updates. Apologies to anyone that was on the last meeting that has to hear me repeat again. But we have some staffing transitions going on within the Bureau. We currently have several positions that are vacant, and all of those positions are posted on our jobs board, open and accepting applications. We still have the non-regulatory services section chief position that is open. That position was formerly held by Ben Fisher. We are also working on adding a new position that will be focused on health equity and public health initiatives. We continue to share Gov Delivery Bulletin updates. I'm sure many of you have subscribed to those and get all of our updates that are sent out on a monthly basis. So apologies, this is a repeat, but after surveys and discussions with many stakeholders, the Bureau will be transitioning to a fully online certification process that will include the issuance of digital certification cards beginning July 1st. More information will be on our Bureau online services page, and so we'll be sure to keep you all up to date that way. We also recently shared that CMS released a waiver that allows Medicare reimbursement for treatment in place due to COVID-19, effective retroactive all the way back to May 1st, 2020. There was new legislation signed, Senate Bill 1377, that now ensures Arizonans acting in good faith during the pandemic are protected against civil claims. This new legislation replaces the previous Good Samaritan executive order that previously provided protections to our providers. Administrative Order 2020-15 that also had provided limited EMS rule waivers has now sunsetted. Those waivers expired on March 31st. However, Emergency Measure 2020-05 remains in place for up to 18 months. That will continue to authorize all levels of EMCTs to provide both viral testing as well as administer vaccinations. We'll keep our COVID website up to date with EMS provider guidance moving forward. We also continue to support the Arizona Surge Line that is providing both consultation and still facilitating transfer of COVID patients as needed. Another add-on is that we apologize for the delay, but we are still waiting to confirm our appropriation for the regional councils for this upcoming fiscal year. Currently, we are expecting funding to return to the level it was in 2019, and that will be without supplemental grant funding at this time. I'll share a few more updates on rules. Article 5, ADHS has submitted an exception request for exempt rulemaking, and that is for the EMS scope of practice, the Table 5.1, to be consistent with best practices and national standards as recommended by the Medical Direction Commission. We do not have a record of approval yet from the governor's office, but we expect there will be a public comment period prior to adoption, and we will keep the committees up to date on the progress of that rule update. In other rule updates, Articles 9 through 11, the department continues to seek stakeholder feedback on ground ambulance rules. We encourage you to visit the ADHS website for upcoming rule work group meetings. The next ground ambulance rule work group meeting has been moved to June 23rd, and the department is currently seeking feedback through surveys that are open on the website. Also, per administrative council and rule, we are seeking feedback on several definitions for ground ambulance rules. If committee members would like to provide feedback, we would encourage you to do so through the rule work group meeting and or the surveys that are open. Ruth Ann is also on the line with us, I believe, and she will be available during the public call to action period and can take any comments or questions that you all might have during that time. That is all I have for now, so that is the end of my report. Thank you again for your service.
Thank you. Any questions for Chief Garcia?
Hi, it's Brian Smith.
Hi, Brian.
Hi, on the scope of practice, Table 5.1, at one point in time, there was apparently consideration to try to remove that from rule as we did all the drug tables. And so I haven't heard anything about that recently. Has that been dropped as a consideration and we're going to just keep it as exempt rulemaking?
Good morning, Brian. At this time, as far as I'm aware, it will remain in rule, and the process we are following right now is exempt rulemaking. That is our request that is pending.
Okay, thank you.
Thank you. Thanks, Brian. Any other questions for Chief Garcia?
Just one, Gail.
Yes.
This Garth Gamer. Is the digital certification process that's taking effect July 1, is that for all levels of EMCTs or just EMTs?
All levels of EMCTs. Any other questions? All right, next I will turn it over to Vatsal for a report on opioid and out-of-hospital cardiac arrest data trends.
Good morning, everyone, and thank you, Dr. Bradley. This is a monitoring. What we are doing since last now almost a year is monitoring of cardiac arrest data over by month, pre and post, pre and during COVID. We're still not done with COVID. Yep. So cardiac arrest data, if you see, we have added 2021 year over here, which is a pink color bar, and till the month of April, we have a 2021 data. So 2021 is added to this graph. And if what we are seeing is, again, increase in the number of cardiac arrest incidents every month. So we see it in the month of January, compared to last year, there was a really increase in number of cardiac arrest in the month of January. Then the February, we saw the increase compared to the last year. March, April, the same thing. So the trend, what we are seeing is increase in the number of cardiac arrests during the COVID. We are seeing the same thing still. We can go to the next graph. Let's go to the number of the disposition transport, not the dead. Yeah. One more thing what we have noticed is that, less people are offering to go to the hospital, opting to go to the hospital, and that kind of, again, we are seeing the same trend. 2020 and 2021, both the years, during the COVID, we see that less and less percent of the people were transported to the hospital compared to the previous 2 years. I think the next would be the opioid. Okay, now opioid incidents, what we observed is that there is nothing, I mean, I don't see kind of a pattern that whether increase or decrease, but what we are seeing is that around 900 to 1,000 cases per month we are observing of a suspected opioid overdose cases since last 3 years. And that's it. And then we can go to the next graph. The number of deaths also is between anywhere between 3 to 4% of people are dying on scene due to the opioid overdose, suspected opioid overdose. So that's about it.
Thank you,
Doctor,
Vatsal.
Shelley, Doctor, I have a question. This is Bob Ramsey.
Go ahead, Bob. Thank you.
Yeah, okay. I was wondering as we move on, would it be important to always have the year prior to COVID to be a comparison in the chart so that we don't get lost once we're in a repetitive COVID environment, and to be able to compare what was happening before and what was happening during the COVID crisis? That's a question.
I think Vatsal can speak to that, but currently, yes, we do have 2019 data in, and I think with the cardiac arrest, we are kind of including moving forward 2019, 2020, and 2021, but I'll let Vatsal speak to that as well. Thank you, Bob.
Sorry, can someone please repeat the question, because it was cutting off for me.
Not a problem. The question was whether or not we can continue to include year prior to COVID data so that we can make sure that we're seeing what our call volume and data look like prior to COVID. So essentially, at least always including the 2019 data.
Yeah, and that is what we are doing it currently also, like, that is our pre-COVID data. So we have a comparison that there is an increase or what is happening. Yeah. So in this graph also what we see that the blue color is 2019. If you can a little bit scroll down, then maybe we should be able to see the year. That's 2019, 2020, and 2021. See, those are the 3 years.
Yes, this is Bob Ramsey. My suggestion is, even when you complete this year, that we should also include 19 for some time.
We should include 19. Is that what you are saying?
No, I was just making a forward suggestion that once we complete 2021, we should probably always show 19 for some time, so that it'll be a 3-year as it moves in for the next year.
Totally agree. Yes.
Yeah. Thank you. Thank you.
All right, excellent. Any further questions for Vatsal? Thank you, and really a big thank you to all the EMS agencies and providers. These data reports aren't possible without the data that you do provide to the Bureau. So just wanted to say a big thank you to all the EMS agencies for the data collection that is performed in the pre-hospital setting and submitting that to the Bureau. This really allows us to be able to provide these data trends back to the EMS community and to this committee. So a big thank you to everyone who participates in AZ Peers. Next, we will move to Standing Committee and Regional Council reports. First up, TEPI, Rebecca.
Good morning. TEPI met on March 18th. Let's see, we welcomed 3 new members. We also recognized Pam Gosler's retirement and thanked her for all her years of service on the committee. We do currently have a vacancy for the role of Air Ambulance Premier EMS Agency Quality Improvement Officer. We also had the Bureau report, the scope of practice update from Chief Garcia, Again, continuing the Bureau, as was already noted today, pushing for exempt rulemaking to allow scope of practice updates with the Office of Administrative Counsel. We also had an overview again of the naloxone Leave Behind program from Dr. Bradley. And then we also had an update with Share from Julie Vinton. Ms. Vinton also works on EMS for children, so she's really got her hands busy right now. She did want to thank all the EMS agencies that did respond to the EMS survey, and she stated that the next survey would be for the hospitals, and it should have started early this month. There was also an adverse childhood experience or an ACEs training that is EMS created, and it's posted on the EMS education page. The Premier EMS Agency Program Status Guide using validation scores was presented by Ann Vosbrink, and she presented the steps she will be following to implement the updated way to measure validation scores for the Premier EMS Agency Program Data Completeness Standard. Other than that, we had the usual updates and notice of upcoming events. Our next meeting is scheduled for July 15th at 0900. And the most exciting part is it says location to be announced. So fingers crossed, we all get to see each other face to face in July. And that's the end of my report. Thank you.
Thank you, Rebecca. Next up, Brian for Education Committee report.
Good morning. I'll skip the report and go up to what our action items were for the meeting. We met on March 18th also. The Pediatric Advisory Council for Emergency Services put together a tracheostomy management for the pre-hospital provider training package to be placed on the Bureau of EMS Education website. That package was approved with a couple of minor amendments. One of them was to add the name pediatric to the title. And the other was to add a disclaimer. The flow of the presentation doesn't delineate scope of practice specifically at any point. So there was a disclaimer put at the beginning of the presentation to define that there are certain things that would relate to individual scope of practice and that they could only provide that within their scope of practice. And so that was approved with those amendments. There was also time for review of the EMS care of the ventricular assist device patient. A work group was formed to look at that package and make recommendations for changes. And I noticed in the MDC agenda that there is also a new one that will be for the total artificial heart patient. Those will be moving to MDC this afternoon. There was also another work group that was approved to be formed to develop a naloxone Leave Behind training curriculum, and that will move forward to, I would presume, our July meeting for approval to be placed on the Bureau's website. And that's it for Education Committee.
All right, thank you very much, Brian. Next up is, did you cover PMD as well? You said education.
I know it's just Education Committee. PMD also met on March 18th. There is an update to the NACIMSO Model EMS guidelines for 2021 and information and background and a time frame for those to be reviewed. We'll have to look at our TTGs that are posted online to determine what kinds of things we may or may not want to include from that NACIMSO package. Also, there was a report given on the University of Arizona and their development of an Arizona CPR and ACLS program. And if anyone is interested in any more information on that package, they can contact Dr. Amber Rice, And in the minutes of the meeting that will be coming out after July will be contact information for her if you're interested in looking at that program for your agency. And there was also a request from Dr. Bradley to look at developing drug profiles for Table 2, which are agents eligible for administration during hazmat incidents. And that's it for my report for PMD.
All right, excellent. Thank you, Brian. Next up are regional council reports. We'll start with Ames and Roy.
The EMS Council report, I won't go over that unless there are any questions. Is in your packet or in the connection link that was provided by Shelley a couple of days ago. It's pretty comprehensive. I do want to point out that on the 9th of June is the EMS Odyssey. It's a one-day event this year. It is done virtually via Zoom. Registration is very easy online. If you go to www.ames.org, and you can get all the information there on the Odyssey. It's very reasonably priced. It's $15 for AIMS members or Arizona Emergency Nursing Association members, $20 for anyone who's not a member, and it goes up to $40 the 1st of June, and there will be no registrations for the Odyssey on the day of. So if you don't get your registration in by end of June 8, you would not be able to register for it on the day of the Odyssey. So encourage everyone to attend. We've got some great speakers this year, and it should be a good time. Thank you.
Thank you, Roy. Next up, Sarah for SAMES report.
Good morning. We are sailing through 2021. Yesterday was our EMS medical directors meeting. We're fortunate to have a large amount of participation. We accomplished several of the things we were looking to do, including the approval and the progress of several standing orders that have gone through the system and were ready for approval, and now we'll head to the council. Our big project is that Dr. Gaither has tasked us with creating a broad representation, multidisciplinary work group addressing EMS to ED communications to improve EMS to ED communications on a number of levels. We finally shored up that work group. We'll have our first meeting is upcoming, but it will indeed be a large task. We have the support of our hospital partners as well, and I think some really good things will come of that. Given the fact that it's such a large project, I suspect there'll also be a report coming forward on what our findings were, and we'll make sure to share that with this group. As for the rest of our 2021 calendar, we will remain on the Zoom platform throughout 2021. As we look forward to the following year, there are no final decisions on what we'll do with our meetings. But again, we'll make sure that we post those to our website as well as get input from our regional partners. That's all I have unless there are questions for me. Thank you.
Thank you, Sarah. Next up, Vince.
Good morning. Well, we had our virtual pediatric symposium in March. It was very successful. Thank you to everyone who attended, and we're planning for next year, hopefully to be in-person conference. We had a council meeting on February 5th. We had elections for 3 officers, and we brought in Peter Como as chair, and he represents Lifeline out of Prescott. We also had a provider grants meeting on April 23rd. We approved about $73,000 to be distributed to our 17 names agencies requesting funding for EMS, training, medical supplies, equipment, and these are rural partners that really show a need for this type of funding. So thank you. We also had a council meeting on May 7th. We had an election for 1 other officer. We brought in Doug Nymensky from CAFMA. He is our new vice chair. And just wanted to mention Kim Moore. She is retiring as the EMS chief of Verde Valley Ambulance. She's been working in EMS at many levels across the state, and she'll be transitioning out of her name's treasurer role. So we wish Kim a happy retirement and thank her for all her dedication and work in EMS, and especially for names. Our next meeting is August 13th. Thank you.
Thank you, Vince. Next up is Rod.
Hey, good morning. We just held our most recent meeting last week on the 13th in Lake Havasu City. It was an in-person and virtual meeting. Went really well. Dr. Spate started us off with the Epic 2.0, which is just a fantastic talk. And we had elections as part of the meeting. Javier Hernandez was reelected as vice president. Enrique Lopez reelected as treasurer. We are finished up with our provider assistance program for this year. We gave out $80,000 to agencies in the Western area. And our next general meeting is in Pine Lake on July 8th. That's all I have.
All right. Thank you very much, Rod. Next up, I'm not sure, I believe Dr. Woolrich is not available. Julia, are you able to give the PACES report for him?
Yes, I will give the PACES report. Thank you. Just a couple of updates on PACES. We do have one vacancy for an emergency physician role. As was mentioned previously by both Rebecca and Brian, we do have a tracheostomy training that is currently posted on the website. We plan on working on a couple of upcoming projects, including naloxone for pediatric patients and pediatric behavioral health. Again, as was mentioned, this year we do have a lot of national EMS for children data collection going on. So we did the EMS survey earlier this year with over 75 agencies participating. Thank you to all who participated in that. And currently, the National Pediatric Readiness Project assessment is going on. So that is a survey of hospital and emergency departments and assessing pediatric preparedness among EDs. So that's all I have. Thanks.
Thank you, Julia. Next, we will move to the discussion and action items. If I can please get a motion to discuss, amend, and approve the meeting minutes from January 21st.
So moved by Glenn.
Thank you, Glenn.
I'll second Roy Riles.
Thank you, Roy. Are there any recommended amendments to the minutes? All right, hearing none, we'll go ahead and start with, is there anyone opposed to the meeting minutes as presented? Please say nay. Hearing none, any abstentions?
Excuse me, I am abstaining. This is Rebecca because I missed the January meeting. Thank you.
Thank you, Rebecca. All right, all those in favor, please say aye.
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 Excellent. Meeting minutes are approved. Thank you. That is the end of our discussion and action items for today. Are there any agenda items that the committee or group would like to be considered for the next meeting? You can either speak up now if you think of anything after the meeting. At any time, you can always email either myself or Shelley with any agenda items to be added to the meeting in the future. Next up is call to the public.
Hi, this is Ruth Ann. Can I be a member of the public?
Absolutely, Ruth Ann. Thank you.
Okay. We are in the midst of trying to review and revise Article 9 of Chapter 25, having to do with ground ambulance service certificates of necessity. In 901, which is the definition section, there were several definitions that the work group and the department believed could use some input from this group in terms of what the definition should include, whether the definitions that are in the draft are sufficient for the time being, and if not, then how they should be changed and why. The definitions that we wanted some input from you on were critical care services and time-sensitive conditions. We also wanted to discuss with you guys and get your input on what staffing considerations should be included in the rules with respect to critical care services. In other words, would a paramedic need to get a certification above the paramedic level to be able to perform critical care services? Should that be available to I-99s, AEMS levels? What training nurses and or physicians might need to be included? Basically, we would like to pick your brains.
Hi, this is Bob Ramsey. I just wanted to include in that list, there's a bad definition of convalescent that needs to be fixed too.
Okay, convalescent transport?
That is correct.
Why do you believe that it is flawed?
For several reasons, but the most important one is you use a preposition "the," which is a reference of the transport that is there, comes back. It should be any. It should have to be any variable ambulance company. So so that needs to be clarified because it's unworkable in the definition.
Are you looking at the March draft of the definition, which was changed from the December draft?
Oh, I apologize. I'm not available. I will look at that, and I'm sorry to take your time, but I will.
Not a problem. Not a problem. Ruth Ann, would you like to provide your email address in the chat box? And that way, if anyone needs links to the survey tool to provide specific feedback, they can do so.
If I knew how to get into the chat box.
I tell you what, I will find your email address and I will put it in the chat box for you. I will put that in there for you, Ruth Ann. That way, anyone who wants to reach out to you directly can. And then if they have any questions about how to access the survey for comment, they have that option as well. So I
think I just put it in, but I'm not sure if it went to everybody or just me.
Nope, you did, and Taylor put it in as well. Thank you, Taylor. So it's in. Perfect. Thank you. All right.
And if you want, I can put in the URL for the web page.
That would be excellent.
Okay, I will do that right now. Reinforcing the lesson and how to do it.
Perfect. Thank you.
You're welcome.
Any other comments for the call to the public section?
Any input as to what critical care services should include? Shelley, do you have those definitions?
If you want to guide me to where they're listed on the website, I can show that.
Ruth Ann, this is Rebecca. From my experience, critical care transport is typically involving patients possibly with multiple trips, possibly on a ventilator. I don't see this being an appropriate skill level for an I or an advanced. There actually is critical care paramedic training certification. It's what really helped us as medics better understand the drips, the drugs, the ventilator settings, just all the things related to a critical scenario. I think anyone with a lesser training than that is going to be very challenged to be comfortable in that role as a critical care paramedic. I know in my own personal history, I carried that certification, and I had that when I was a flight medic. It's not required for a flight medic, but I wanted every possible education I could get before I was up alone with a patient at 40,000 feet. So yeah, that's just my opinion on it. Thank you, Ruth Ann.
Thank you. We didn't really think that I-99s or AEMS or AEMTs would be included, but giving you the option to say yes, they should be. Vincent has a definition of convalescent transport.
Yes, and this is something we've already discussed at Article 9 meetings, but we don't want to turn that in. We don't want to turn this meeting into that meeting. But I'm just going to.
No, we don't. No.
And that is based on the latest version that you have. Thank you.
Thank you, Vince.
Okay.
Our hope is really to just remind everyone who maybe does not participate in those rule writing meetings on a regular basis, there is still the option to provide online feedback, and that's the link that I believe Ruth Ann just shared. So please, if you have thoughts or feedback you would like to provide to that group, but don't necessarily have the time to participate in the committees, that's definitely the right venue to share that information. So please participate.
In addition, we try to get representation from all the different groups that might be affected by these rules onto the work group. So if you, and the work group list is posted on the website that I gave you. If you know any of these individuals and you don't want to try to explain your concern in a written form as a comment, you could always talk to one of those individuals and have them present your concern at the work group meeting.
All right. Well, thank you, everyone. Definitely want to make sure we get good stakeholder involvement in that process. We will go ahead and move to the summary of current events. Shelley, if you can scroll down just a little bit, please. The current events are listed and displayed right now in your packets that you received electronically. There are live links to these different training options. I think most are remaining virtual at this time. We also have links to the Bureau's training opportunities and programs listed as well. Our next meeting will be September 16th at 10:30 a.m. Location to be determined. Unclear if we will continue with a virtual only format. As we get closer, we will let you know. As I'm sure you all are aware, we've always had the virtual option. That option will continue as well. Can I get a motion to adjourn, please?
So moved, Brian.
Thank you, Brian.
I'll second that, Vince.
All right, thank you, Vince. All right, meeting is adjourned. Thank you, everyone.
Thank you.
Thank you.